Welcome to the Health Bus. The Health Bus circulates around the province of Lleida, performing diagnostic tests to identify people who may have cardiovascular or renal problems before disease appears. The bus is equipped with the most advanced diagnostic technology available, so that after carrying out a few tests and before you go back home, we can tell you the state of your cardiovascular and renal health. We send the results of the tests to your family doctor. In the event that we do detect any anomaly, your doctor will carry out the treatment plan and help to slow down or stop its progress, thereby avoiding the appearance of more serious problems in the future. And this is our objective: to prevent the appearance of renal and cardiovascular disease. In order to develop the tests for this project, a random selection was made of people between the ages of 40 and 75 with risk factors relating to the emergence of cardiovascular and renal disease. Certain unhealthy habits, such as a sedentary lifestyle, high-calorie diet that increases cholesterol, tobacco, obesity, alcohol, age, or pathologies such as diabetes and high blood pressure are risk factors that facilitate the appearance of diseases related to the kidney or the circulatory system. Blood pressure is the force exerted by the blood against the artery walls and blood vessels as it circulates around the body. If the pressure is too high, it can damage the arteries of the kidney and, in time, lead the kidney to stop working. The job of the kidneys is to filter the blood to eliminate toxins and the excess of water, sodium, potassium. So if the kidneys stop, an overall intoxication occurs, requiring dialysis or a transplant. The same occurs with diabetes. If diabetes is not well controlled, the kidney slowly and imperceptibly stops working without anyone detecting it at first. This is why 10% of the population has kidney disease without realizing it. Diagnosing in time is a determining factor in saving the kidney before it is too late. The arteries carry blood, oxygen and nutrients from the heart to the rest of the organism, so it is very important that nothing obstructs them. With these unhealthy lifestyle habits that we mentioned earlier, the excess of fatty particles that circulate in the blood are deposited on the inside walls of the arteries, creating plaque or atheromatous plaque that leads to the narrowing of the inner walls of the arteries, which reduces the space for the blood to flow. When this happens, there is not enough blood to satisfy the needs of some tissue, and this lack of blood results in damage, or often death, to the tissue. If this damage takes place in the heart, it leads to angina pectoris, or myocardial infarction. If it takes place in the brain, it can lead to a stroke. And when it affects the lower extremities, peripheral arterial disease, it can lead to the amputation of limbs. Cardiovascular disease is the number one cause of death and disability in developed countries, above cancer even. In Lleida alone, the disease is responsible for 30% of deaths. The resulting health expenses and decline in work productivity costs the European Union around €200 billion per year. And even though the implementation of the stroke code in hospitals saves many lives every day, the incidence of these diseases is far from disappearing. Only early detection can reduce the number of future victims. An ultrasound is the tool that allows the arteries to be seen and to check if there are fatty deposits, atheromatous plaques. Just by looking at the carotid and femoral arteries, we can know the state of the whole body. It's a technique used in very specialized centers. It is non-invasive, has no contraindications, and most importantly, is painless. The Health Bus brings technology to people and means that people at risk of suffering from cardiovascular or kidney disease can be diagnosed early. The Health Bus stops so that you don't.